Medication Administration Training Program, Anaphylaxis and Emergency Treatment.
A child's immune system is the body's natural defense. A healthy immune system recognizes foreign substances, such as bacteria and viruses, as being different from the child's normal body tissue and destroys them. The immune system allows the child's body to fight off infections. However, the immune system is also responsible for allergic reactions, which happen when the immune system responds to a substance called an allergen to which the person is allergic. Some common things that can cause an allergic reaction in children include insect or bee venom from bites or stings, nuts, some medications, especially antibiotics, berries, eggs, and wheat. Most allergic reactions are mild. If the child has local itching, swelling, or a slight rash as a result of contact with an allergen, this is considered to be a mild allergic reaction. Allergic reactions can get worse with each exposure to the allergen. Anytime a child has an allergic reaction, you should contact the parent and encourage her to follow up with the child's healthcare provider right away.
Anaphylaxis.
A child may also experience a severe allergic reaction called anaphylaxis that requires immediate attention. Anaphylaxis can affect many different parts of the body. In the lungs and throat, severe swelling can occur. This can cause wheezing, difficulty breathing, or difficulty swallowing. If not treated quickly, the child could pass out and even die. When the skin is involved, massive itching and swelling can occur all over the body. Swelling happens quickly and may be particularly severe in the hands, lips, face, tongue, and throat. The child may also vomit, have diarrhea, be bent over with abdominal cramps, or complain of a metallic taste or itching in the mouth. A child's heart and blood vessels may also be affected. When this happens, a child may feel faint, complain of a racing heart, become extremely pale and sweaty, or even pass out. Because anaphylactic symptoms can progress very quickly to an emergency situation, if a child in your care has any of these symptoms, call 911 immediately. There are many things you can do to keep children away from allergens. Be sure you know all the allergies of the children in your care. You can't protect them from what you don't know about. The Food Allergy and Anaphylaxis Emergency Care Plan in your handouts is a great tool that can remind you of a child's allergy triggers and what to do in an anaphylaxis emergency. Children with asthma can develop anaphylaxis. The MAT program offers a free online module about asthma and how to minimize asthma triggers. If you have children with food allergies, avoid having that food available in your program. Be extremely cautious when outside because insect stings can occur throughout most of the year.
Using an epinephrine autoinjector.
Let's talk about emergency treatment for anaphylaxis. Epinephrine is a medication that can help relieve the symptoms of anaphylaxis and can save the child's life. Epinephrine is given using an autoinjector. An autoinjector is a device that automatically injects a pre-measured amount of medication into a child. In this course, you'll learn how to administer the EpiPen autoinjector. There are other devices, such as regular syringes, that can be used to inject epinephrine, but this course does not authorize you to give epinephrine by any device other than an autoinjector. Epinephrine is a prescription medication that is for a specific child. If a child in your care is having symptoms of anaphylaxis and does not have an epinephrine autoinjector, get emergency help by calling 911. In a child daycare setting, you may not use one child's EpiPen for another child under any circumstances. Regulations for shared use of epinephrine autoinjectors may be different in school settings. Please contact your regulatory authority for specific information. Store epinephrine in a place where you can get to it quickly, such as in the first aid kit. The autoinjector should be close at hand, but in a locked container. Also, don't refrigerate it, expose it to direct sunlight, or store it in a place that can get hot, such as a car or glove compartment. Instead, keep it at room temperature. And remember to check the expiration date on the epinephrine autoinjector periodically. Let the parent know in advance when it's about to expire. Now, let's discuss how to give an EpiPen injection. If another employee is available, have them call 911 to get emergency help for the child while you are administering the EpiPen. Quickly match the 5 rights. Flip open the yellow cap of the EpiPen or the green cap of the EpiPen Junior carrier tube. Slide the autoinjector out of the carrier tube. With your other hand, remove the blue safety release by pulling straight up without bending or twisting it. Grasp the autoinjector in your fist with the orange tip pointing downward. Never put your thumb, fingers, or hand over the orange tip. That's where the needle comes out. Hold the child's leg firmly in place before and during the injection so it cannot move. Place the autoinjector against the middle of the child's outer thigh at a right angle, perpendicular to the thigh. Swing and push the orange tip firmly against the outer thigh until you hear a click. Hold the EpiPen firmly in place against the thigh for approximately 3 seconds to deliver the medication. Count slowly, 1, 2, 3. The injection is now complete. Remove the autoinjector from the thigh. The orange tip will extend to cover the needle. Massage the injection area for 10 seconds. If 911 has not already been called, call 911 right away to get emergency medical help for the child. Match the 5 rights and document the dose. Notice how the dose and route are documented, as well as the symptoms the child was having and notification of the parents. Send the used autoinjector with the child to the emergency room. After giving epinephrine, you should immediately start to see the symptoms of anaphylaxis improving. The child may complain of shakiness and a racing or pounding heart. These are typical side effects and are not a cause for alarm. Symptoms can reoccur even hours later, so even if the child appears better, he still needs emergency care. While awaiting for emergency care to arrive, call the parents. Avoid unnecessarily moving the child and keep him warm and calm. Here's how to match the 5 rights for an epinephrine autoinjection when every second counts. When the parent dropped off the epinephrine autoinjector, you review the consent form to make sure it matches the prescription label on the autoinjector or its carrier. Since epinephrine autoinjectors only contain epinephrine in a pre-measured dose, and the route of administration is always the same, it should only take you a moment to match the 5 rights before giving the dose. As we've discussed before, if you are certified to administer EpiPen, you are also authorized to administer other epinephrine autoinjectors after receiving additional training on that device. The MAT program offers a free online AviQ course with the printable completion certificate, which you can use for this purpose if you'll be administering AviQ. Check the MAT Online Learning Center for current course availability.